Nursing school is tough and the struggle is real. So if you want helpful tips, videos on skills, lectures, and many other tools and helpful things that will get you over the hump, please like and subscribe to my channel, Professor Kristen. Hi, it's Professor Kristen, and one of the things that I like to do is go through a lab bag with new students. It's important that if you're new at this and you've never seen a real Foley catheter, or if you've never touched a syringe or anything like that, to go through your bag and touch everything, get it out, see how it works. It's okay, it's not gonna bite you. And the more familiar you are with what's in this bag, the better and more comfortable you'll be in lab when it's time to get these tools out to use as you learn your skills. So let's get started. So let's open the bag. As we open the bag, it's almost like Christmas. Well, not really, but close. So there are different things in your lab bag. This is a dressing tray. We just recently used this in lab. And as you can see, there's different things listed that are included in this tray. So it's good. Open it up. Gently open. There's a perforated area so that you can slip everything back into the bag and bring it with you. You'll need to use this over and over as you practice here in lab. There is a CVP dressing tray. And so this includes a mask, a pair of gloves, there's a towel, an antiseptic applicator, medical tape, transparent, film dressing, you've got alcohol, forceps, gauze. So this is when we're doing central line dressing changes. And so this is what you'll need. There's a baggie full of goodies all in here. So as we open up this baggie, there's different things. You have bubble wrapped, actually, a little baggie full of ampules. And it's very important that sometime during your lab class that you learn to pop an ampule and draw out with a filter needle and the purpose and why you do this. So please always keep these in the bubble wrap because they are glass and they will break. There is tape. We have 4 vials, which is awesome to practice with. This one is a regular insulin, and these are just for practice. Bubble wrap. There's another NPH. Just a Practi vial of 10 milliliters, which is a good thing to use when you're drawing up and practicing your injections. And this is actually Practi powder. And so we do reconstitute medication still. So sometime soon you'll learn to reconstitute by adding fluid into this. And there's actually directions on the back of this vial. So it's a good thing. You can even take it out, look at it, read the back, and it'll explain it to you. So you're a little familiar or more familiar with that when it comes time to actually doing that skill. We've looked already, but we have syringes, that's a 3 cc. We have 2 25 gauge 1-inch needles with safeties. 10 cc syringe. Another needle, we have different sorts, 21 gauge. Just remember when you're looking through the bag, if you wanna know what gauge and what size needle, it's right on the front of the packaging. Same with your actual syringes. When you look, it'll say a 10 milliliter Luer lock tip syringe. So you know what you're looking or working with, and then also flip it over. Take a look at it. If you want to open this packaging up, open it up. This is your bag, you bought it. Open it up and take a look. Good things. Take it out and practice. We have many syringes. Insulin syringes, and you have 2 actually in your bag. You have a 100 unit. So if you take it out, look at it. There's different markings that go up to 100. And then you have a 50 unit. So it's very interesting. The 50 is a 0.5 milliliter syringe, insulin, and the 100 is a 1. Orange is insulin. Always remember that, because you should not use these syringes for anything else. And when giving insulin, always use an insulin syringe. I know there are people that want to calculate with the TB syringe and say, well, if I was going to give this, it'd equal this. There's a reason why evidence-based practice, safety, that they have said this is universal. We see it across our entire country that we have insulin syringes. We teach our patients, and it just creates that safe environment. A TB syringe is a 1 milliliter, has very small units so that you can measure. It's a 27 gauge needle. We'll do intradermal injections with this. We also can do sub-Q if we need to. It is a very small needle though. We have actually IV catheters. You have a 22 gauge, another syringe, still more needles, a 20 gauge, actual AutoGuard winged. It's got a safety on it. That is an IVs. We have filter needles. We have blunt filled needles. Red is the blunt filled in this kit and brown is the filter. If you want to know, just read the label. Also, when you're using things that come out of the bag, another syringe, please look at the expiration date. Get in the habit of everything you use having an expiration date, and you should be checking it to make sure that it is still with, has not expired, because you don't ever want to compromise safety with your patients or clients. We have an ABD pad. It has the blue line down the center. Think sky. If the sky is blue, the blue line always goes up towards the sky. And even more dressings in this one baggie. I mean, this is like bingo. So we have different transparent film dressings, or what we used to like to call a name brand Tegaderms. And you have several, 1, 2, 3. We have several 4x4s, and we have several 2x2s. So please, as a student, take a look. I also want to point out that if you look at your gauze bandages, at the top of the gauze here, or on the side, however you're holding it, it would be on the side, there's a measurement, so like a ruler, so you can measure wounds and different things, you know, if you're measuring something on the body. It's there for you. Even on your 4x4, if you take a look, it is in centimeters. That's what we measure in, and you can see it is right across the side there. That's a great asset. That's the baggie, but we're not done yet. I feel like I want to get down in there. But anyway, we have an IV extension set. Actually, 2, which is nice. We have a tracheostomy clean and care kit. When we get to that, before you come to lab, open this up. Open it up and take a look. Just whatever you do, try to put it back in the way you found it. And you know, anything that you open, if it's wet or moist, put it in a baggie so that you can keep it, but don't throw anything away. Also, I was gonna say this, if you wanna know how it comes out of the package, I open things and take a picture with my phone, and then I can refer back to it. We have a dual lumen Salem sump tube with an anti-reflux valve, more or less an NG tube, a Salem sump. It needs to sump. Something to look up when we go to study these. Putting down NG tubes. Let's see, we have a colostomy ileostomy kit, which is absolutely awesome. The entire kit has a wafer in there, and we have a pouch, and also different things to measure our ostomy with. I'm looking for my perforated end. I don't actually see one on this, or maybe it's on the side. It is. I can feel it, I feel. Here it is. So everywhere you have something, there should be actually different perforated areas, so you can just peel it back gently. So we have a wafer, which is awesome, and you'll learn to measure and apply. We have a drainable pouch clamp, and the clamp in there will go on to our actual pouch that we can apply to our patients, ostomy. Also, just FYI, we have in this little kit instructions. And the instructions, you think, you know, okay, Miss Blau, whatever, okay, Professor Kristen, but the instructions are great. Anything that you get, a vial of medicine, anything, even as a nurse throughout the years, if it was a new medicine or something, I would pull the information sheet and take it home just to take a little peep at it. And so these are great to look at. Hollister is a great company that makes really good things for ostomies. We have a Curlex bandage roll. We have different fluid. This is 0.9% normal saline, and this is a 250 milliliter bag. We have a suture removal tray. We have a 500 milliliter normal saline bag. We have 2 sets of, or I do, of sterile gloves, and in class you've received sterile gloves, so those are your sterile gloves that would have been in the kit. We have a 100 milliliter normal saline bag, and how do you know what size? At the top of the bag, it tells you 100 milliliters. It also tells you what it is, 0.9% sodium chloride. And up at the top, here's the expiration date, and there's a lot number, so that if we ever had issue with anything, you know, we can actually have it traced back to when it was actually made in the factory. Also, too, we have an Alaris pump infusion set, so that you will learn to spike and fluids and hang them on our Alaris IV pumps and learn to program and use those, so that when you get out into the clinical world, you're able to use the pumps and have some proficiency in them. We also have, let's see, a Foley catheter kit. This is a 14 French that deals with the size, and you'll learn that as we go through lab, learning to put in Foley kits. And in this bag, you're actually given 2 kits. One kit I am asking you to hold on to. Don't open it, do nothing with it. That is the kit you will test with. And before you come see me, I would like for you to open this with the perforated packaging is. Open it gently, take it out, open it up. Watch the video on Professor Kristen, and there is an actual video on there that has Foley insertion based on step-by-step evidence-based practice of how to insert this. But take a look at that, read through your book, and familiarize yourself with what's in the kit. Now, the thing I do ask you is try to put the kit back together just like it is, so that you can practice, so that when you go to your second kit to test, that you're not, oh, wait a minute, that wasn't there. So try to always put them back together, but definitely open them. Oh, there's more stuff in here. It's your injection block. It's kind of a soft tissue for you to be able to inject. Now, I will say this, it has a strap, so we can strap it different places on a mannequin for you to be able to know to give the injection there and what injection we're looking for according to our sites. But also, just FYI, it will leak a little bit, so I always say put a little paper towel or something under it when you're using it. Actually, you have an IV start kit, and you have powder-free vinyl gloves in it, gauze, a dressing, tourniquet, ChloraPrep, and tape. All you need to do is add your your extension, your IV extension that you have 2 of, and you have actually the IV catheter. So you get that all together and you'll be ready to start IVs. We have secondary tubing, secondary IV tubing. It looks like this, and you see the green little connectors. Some of them have blue. If you don't lower that primary bag, you actually will not infuse your secondary. All the fun things we're gonna learn. We have a 10 French mini suction catheter tray so that we can suction out, actually go down with trachs and stuff and do actual suctioning on the mannequins. And one more IV start kit. And as you see, you can turn it over and look at it. Let's see, what else do we have in here? You have a great bag that has nothing on it, and I always say it's a great gym bag. And once you're done with nursing school and are successful, and a strap so you can carry the bag back and forth into lab and enjoy. So that is the 2020 lab kit for our college and nursing students, and I just hope all of you out there, if you're in a program with a lab, that you're able to have different tools and product to use so that you can practice and be a safe, efficient nurse. Hope this helps.